zinapougua kwa kutenda dhambi. Yesu ndiye tabibu mkuu wa roho zetu, naye yu tayari kututibu kila tunapougua.
Kupata kitubio kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100273 kwa 811.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Good morning. It is indeed a very beautiful Friday morning, and as we call it here at Capuchin TV, it is a Health Friday. Now, we believe that health is the most valuable asset you'll ever invest in, and that's why we bring you these kind of informative sessions every Friday to make you, to help you make informed decisions when it comes to health decisions. Now, today we are going to talk more about health and what others call telemedicine. We're going to get to understand the two, telemedicine and telehealth. Is it a blessing? Is it a double-edged sword? What are the pros and cons, and why should you embrace telemedicine in this digital era? And in studio, I've got a very beautiful doctor. I'll let her introduce herself before we proceed. Dr. Thuo, good to have you.
Thank you very much.
Welcome.
Good to be here. Thank you.
Please tell our viewer who you are and what you do.
I'm Dr. Yvonne Thuo. I'm a medical officer and the telemedicine clinical coordinator at the Mater Misericordiae Hospital. This means that I oversee the telemedicine agenda at the hospital.
Wow, that's great. Now, remember, your feedback and comments are really valued here, so you can be part of this conversation, this health discourse by sending your comments, your questions on our social media platforms. You can also talk to us directly or send an SMS to 0717-424-866. My name is Sasha Elizabeth. Welcome, and let's talk telemedicine. Dr. Thuo, now, what is telemedicine for the sake of those probably who don't really understand what this is?
All right. In a simple way, telemedicine is the use of technology to diagnose and manage diseases. Yes.
So that's in simple terms. So what is the difference? Is telemedicine and telehealth the same thing?
No, it's not the same thing. It's commonly used interchangeably, but telehealth is the umbrella term. It's the use of any technology in healthcare, whether this is in surgery, such as robotic surgery, whether this is in training the healthcare workers, such as e-learning or e-training, or whether it is in prioritizing who gets to be seen first, for example, which X-ray report should be read first, like in artificial intelligence, or when it comes to diagnosing and managing the patient, you have telemedicine. So you can think of telehealth as this big umbrella term.
Oh, okay. Thank you so much. Now, why should we embrace telemedicine, or personally, why should I use telemedicine?
Actually, we have all used telemedicine. When you pick up your phone to call your doctor and say, I have a headache, you gave me painkillers, but my headache is still there. That is telemedicine, because you're using the mobile phone. That is a form of technology. Yes. When you have a rash and you take a picture and send it to your nurse and say, my baby has this rash, that is telemedicine. So really it is here with us. We have been doing it for a long time, and it is really the future of healthcare. We have to embrace it because it is convenient, it saves you time, it saves the healthcare worker time, and it can also be affordable. You know, it is traditionally more affordable than the normal consultation.
So we've been just using it inadvertently without really knowing that this is telemedicine.
Exactly. When you go to a laboratory and you do you have a test performed, and they email you the results, and then you email to your doctor, and your doctor emails you the instructions. All that is telemedicine. Yes, so the thing is, now as a country, and specifically at the Mater Hospital, we want to organize this. We want it to be, one of the main ways of accessing healthcare for the patients who can access healthcare through telemedicine.
Great. Now, every kind of technology, they say, has some shortcomings in the same, that comes in the same package with the advantages. What would you consider as the drawbacks in telemedicine or telehealth generally?
That's a good question. The advantage we have is that telemedicine has been used by millions of people all over the world. It may be a little bit new to us as a country or as a region, but it has been used globally for years, meaning that the issues that were there with maybe the technology not being so good have been refined over the years. But what I can say are the drawbacks. One, you have to have the technology, and acquiring technology is costly. So the facility has to acquire all the digital equipment and the software that are needed to support telemedicine. And the development of this equipment and software costs time and money. Again, the patient, if it is telemedicine where the patient can access services from home, the patient also needs to access internet. They need to have a smart device like a smartphone, a tablet or a laptop. And when we talk about wearable monitors and all the advanced things that the patient can take home so that it can help in managing the patient, then those also cost money. So that's the main drawback. But the good thing is, in the Mater Hospital pilot, we have tried to address that drawback, because the patient will come to our hospital and then will access telemedicine. So they don't incur the expense of requiring to have the equipment and software at home.
Oh yes, we can also factor in the cost of maintenance, maintaining the technological devices, and also upgrading after a while.
Yes.
Okay, so when we posted today's topic, someone asked, can I access telemedicine in the comfort zone of my home?
Yes, you can.
What do they need to do that?
Yes, you can. However, during the telemedicine pilot, the pilot is a start, trying to gather data and see, will our patients benefit from this? Will our healthcare workers benefit from this? Will we have better outcomes, have better patient management and so on? And because it is a pilot, it is free to the patient, and we have designed it such that the patient has to come to the medical facility, to one of the sites at the Mater Hospital, in order to access it. Later on, after the pilot, we may have a situation where the patient can access the services at the comfort of their home. And in that case, what the patient needs is internet and a smart device, maybe a smartphone.
Okay,
yes.
Thank you so much. Please tell us, how common is telemedicine in Kenya and globally?
So globally, it's quite common. Some countries have really embraced telemedicine for a number of years now. I'll give an example of Australia. Australia is a vast country, and you have areas which are very remote, where doctors are not able to go and provide their services. And one of the ways they've addressed this gap is to place a healthcare worker, for example, a nurse in that region. And when the nurse has a case that requires a doctor, the doctor is able to appear on the screen very quickly, and using the other equipment, the doctor is able to guide the management of that patient. In the USA, it's also picking up, especially with the COVID-19 situation. It has really put telemedicine on the map, because people were being asked to stay at home. People were being asked not to go to the hospital, to call in advance. And so it saw a rise in the use of telemedicine in most countries, including Kenya. Telemedicine has been in Kenya for just a few years. However, during this pandemic, we have seen an increase in the use of telemedicine.
Thank you, Dr. Thuo. Now, whenever there's a new invention in the medical field or any other industry or professional field, there is always a crucial question of safety. How safe is it? How safe is telemedicine in terms of equipment, the process, and even the safety of personal and confidential patients' data?
So safety is a key component in quality healthcare. And if you look at the standards that we use in healthcare, safety must be addressed. And so telemedicine has been designed in such a way that we must look at the safety concerns and address them. So as we use telemedicine today, it is quite safe. When we look at the digital equipment has been developed with all the necessary health standards, and before it is released for use, it has to meet the threshold of all those standards, and the equipment that we're using at the Mater Hospital has met those thresholds, meaning that the equipment is safe. Then when we look at the process means, which patients can safely be seen using telemedicine and which ones can't. And this is an important thing, and that's why at the Mater Hospital, during our pilot, we are requiring patients to come to the hospital. If a patient has an emergency condition, for example, a patient who has collapsed, that is not a patient who can be seen remotely using telemedicine. Telemedicine can be used in a situation where the patient has come to the hospital and then a senior doctor has joined in virtually, but on the ground you have doctors and nurses and all the qualified healthcare workers to attend to that patient. So telemedicine is best used by patients who are stable and who are not in an emergency situation. For example, if you have diabetes and you are on anti-diabetic medication, then you can use telemedicine to manage your diabetes by calling in, by having a healthcare worker checking in on you using telemedicine. And we believe that this enhances the quality of care and enhances the outcome for the patient. Finally, when we talk about safety of the data, this is also a very key part, a very key question. Thank you for asking that. We have standards also that tell us how to protect the data. So the software that we are using, or the standards that we are using at the Mater Hospital, we're looking at the Kenya Data Protection Act. And through that, we are guided by that in our data protection policy. And this stipulates who can access this data, how is the data stored, how do you get that information if you need it, and so on. It's quite a broad, holistic way of managing data. In addition to the Data Protection Act of Kenya, we are also guided by the HIPAA, that's the American standard, and the POPI, that's the South African standard, because the software we are using has been used internationally.
So data is encrypted, nobody can access it?
Yes. During the consultation,
unless authorized by the hospital.
Yes. During the virtual consultation, the teleconsultation, no one can join in and listen or see what is going on. So access is limited only to the healthcare provider and the client. Then after that, that data is stored in an encrypted way. And encryption means that it has been put in a way that cannot be accessed unless authorized.
So can this data be made available to the family members or the next of kin to the patient?
Yes, it can. In healthcare, every patient has a right to information. So once you have been seen and you request to have data, we can give a medical report. If it is an image, you can give the image. If there are laboratory findings, you can give a copy of the laboratory findings, and so on.
Okay, so how can patients access telemedicine at Mater Misericordia Hospital specifically?
All right, like I mentioned, we are running a telemedicine pilot, and this started in the month of September, and we are going to run it in 5 sites. We'll have the antenatal clinic at the main hospital. Here we have a service known as the midwife consultant clinic or midwife-led antenatal services. And what this means is that the mother will be attended to by the midwife from the point of the antenatal, that's before birth, to the point of delivery, to the point of postnatal, that's after birth. And this is an exciting thing because we've seen that mothers who are attended to by midwives tend to do better. And of course, it is better in terms of the financial aspect. So in this midwife-led clinic, the midwife will be able to consult with the specialist. So the specialist will appear on the screen and will be able to interact with the patient, talk to the patient can hear the consultant, and then say for example the fetal sounds are being checked. Both the mother can hear, the midwife can hear, and the doctor can hear from wherever the doctor is located. The other site we'll have at the main hospital is the medical ward, and this is the infectious disease unit where we house our COVID patients and we can cater to other infectious diseases. And then the Macaulay ward, which is also the medical ward. And what will happen here is that we will enable the use of virtual ward rounds, which means that the doctor can come and see the patient remotely. So there will be a telemedicine cart. It's a device that can be moved around, and you take it to the nurse takes it, or the medical officer takes it to the patient's bedside, and then from there the consultant can appear and conduct the ward round. And again, there'll be use of digital equipment. So for example, if we are doing a chest examination and we are placing the gadget is called a stethoscope on the chest. Then the doctor or nurse who is with the patient can hear those sounds, and so can the doctor who is joining remotely. And it's really like the doctor is in the room, only that there's that use of telemedicine. The other sites are in Kasarani Clinic, which is located at the Thika Road Mall, and the Thika Clinic, which is located at the Chania Mall. And in this pilot, we'll have 3 specialities: the OBS-GYN, this is about women's health; then internal medicine. This is where, like, if you have a problem with your heart, your lungs, your brain, and so on, that's where that is internal medicine. And then we have the surgical specialty.
So now, in a case where you need to take some specimens to the laboratory, the patient's specimen, what happens?
So during what we're offering at the Mater Hospital, the patient will be in one of our sites. So we'll be able to take the samples, and then the doctor can see the results and be able to guide management. For telemedicine, where the patient is at home, then there are a number of options. That is where home sample collection can be done, which means that we send somebody to the patient's home to collect the specimen. Again, also there's a priority service that can be done, which means that the patient can go to the facility and be attended to on a priority. Yes.
Thank you so much, dear viewer. Now, more than ever with this COVID-19 pandemic, there is need to embrace technological advancement, and this is telemedicine in the medical field. Remember, this show is brought to you by Capuchin TV in partnership with Mater Misericordia Hospital. Now, when we come back, we will be we'll be sampling some of your questions and feedback so that we can get the doctor to respond to them. So continue, keep your questions coming, keep your feedback coming, and when we come back from this break, we will get to respond to them. Time for a commercial break. We'll be right back shortly.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
welcome back and thank you for keeping it Capuchin TV. It is a Health Friday, as I mentioned in our first session, and today we are discussing telemedicine with Dr. Yvonne Thuo, telemedicine coordinator at Mater Misericordia Hospital. Now, before we proceed with our next session, allow me to read out some feedback from our audience. Rogers Wanjala, watching from Diocese of Bungoma. Thank you, Rogers, for keeping it Capuchin TV. Julius Omungo, telemedicine is a very positive step on patient outreach and management. Thanks for the initiative. Absolutely. Caleb Cases, good morning, watching from Mount Elgon. Thank you, Caleb. You can keep your questions, your comments and feedback coming to us on our social media platforms, YouTube, Twitter and Facebook, Capuchin TV, hashtag Asashi Elizabeth, and you can also send an SMS or call 0717-424-866. Now, before we went for a break, we were trying to understand more about how we can access telemedicine at Mater Hospital. Dr. Thuo, welcome back to the second session. So what type of technologies do we use in telemedicine?
All right, thank you, Elizabeth. So when you come to the Mater Hospital telemedicine site, say for example you walk into our Thika clinic, which is in the Chania Mall building. So you'll be attended to in the normal way. Go to registration, go to the nursing point for triage, then go to the general doctor, the medical officer. So once you're with the medical officer, then he or she may determine that you need to be seen by a specialist. So instead of sending you all the way to the main Mater Hospital in South B, then we will use telemedicine. So what will happen is the patient has to sign a consent form saying that they understand that they're using telemedicine. It's quite detailed, and saying that they're okay if the information used if the information gathered during that time can be written up in a study. So once the consent form has been signed, then the consultant appears on the screen, because they will have been called by the medical officer, and the consultation happens. During that consultation, there are devices we are going to use. The stethoscope, the one that is for listening to the heart and the lung sounds, that one is digital, and like I explained earlier, then it means that the doctor who is remote, the virtual doctor, can be able to hear those sounds, and so can the doctor with the patient. And the patient can also hear if they so wish. We can record those sounds so that we can, study them in detail later on. And like we said, all this information will be very safe. Then the other devices that we are going to use are digital fetoscope. This one is for listening to the sound of the baby, for pregnant mothers to listen to the fetal heart sounds. And then we'll also have a general examination camera, which can look into your ears, your mouth, you can examine the skin. It's a multi-purpose general examination camera. Apart from that, we have a very high definition camera that allows the patient and the specialist to see each other very clearly. And then we have a noise cancelling speaker that is able to filter out the noises. So when you speak, it's like you're in the same room. Yes.
So that's the step-to-step procedure of telemedicine, a patient who's supposed to go through telemedicine?
Yes. Once the consultation is over, then the medical officer can institute the management that has been discussed, and the prescription or any lab investigations or any other investigations can be done at that point. Then the patient fills in a patient survey form telling us about their experience and whether they prefer to use telemedicine again or they prefer the physical consultation, the face-to-face consultation.
Okay, all right. Dear viewer, that's what you should expect when you visit Mater Hospital and the selected satellite clinics for this pilot telemedicine project. And of course, the Dr. Thuo has also mentioned the technologies that they use to ensure that there's a clear communication between you and the specialist who is in charge and who is taking care of your condition. Now, before we proceed, there's some feedback here. Lucy Gadukia says, congratulations Mater Hospital for this initiative. Telemedicine is the way to go. Then Mary Kiyoko, good to know these services are available. Thank you, Mary Kiyoko and Lucy Gadukia. Now, there is a question. Is the quality of care the same as an in-person care? If I was to come to see the specialist one-on-one, is it the same quality standard?
I would answer yes, depending on the patient selection. You remember I mentioned that not all patients can be served using telemedicine. So once the patient selection is accurate, meaning that it's a patient who fits the criteria to be seen using telemedicine, then the quality of care is the same as an in-person consultation.
All right. So now, after the pilot project, will you consider, do you intend to do another pilot for the home-based telemedicine? That's if someone would like to be seen from their home or any other place rather than the hospital?
That's a good question. So the Mater Hospital is invested in introducing telemedicine to its clients. That is why we are conducting this pilot, so that we can understand our clients' needs in terms of telemedicine, and then so that we can now roll out a telemedicine service where the patients will be charged. The pilot is free to the patients. So after the pilot, then we're going to analyze the data and see which other sites can we include, what other services can we have. And yes, we plan to have the remote patient access, that is where the patient can be attended to from home, among other telehealth options.
All right. And is it difficult to use telemedicine because some people feel they are not that much tech savvy to be able to go through this process? Could you please tell us more about that?
So for the patient who's been attended to at home, all they need is a smart device and a good internet connection. The application that we are using at the Mater Hospital doesn't require a high bandwidth, which means that even with a limited internet connection or a limited bandwidth, the patient can still have a good quality video consult. So the patient only needs those two, a smart device and the application on their phone. Then secondly, it's important that the patient is in a quiet room that is well lit, so that the healthcare provider can see the patient clearly and quiet, so there are no interruptions. So it's fairly straightforward. If somebody can use a smart device, they can do a telemedicine consultation comfortably. If somebody can use WhatsApp, for example, or any other application on their phone, then they can do a telemedicine consult.
Wonderful. Now, Calvin Mandela is asking, does insurance pay for the plans, pay for telemedicine services? Do you know if there are insurance plans that can cater for telemedicine services?
That's a good question, Calvin. Yes, there are insurance companies or health insurance plans that pay for telemedicine. The international ones have been paying, and the local ones are catching up. Like I mentioned, especially during this COVID-19 pandemic, telemedicine, it became a reality, because there are patients who require to be seen using telemedicine, and so also the local health insurance plans are catching on, and a number of them are paying for it.
So does telemedicine need to be recorded? Can you record the conversation between the specialist and the patients for future referral or anything?
Yes, it can be recorded. You can record the video, and you can also record the images. And every health encounter is supposed to have a health record according to the health regulations, health laws. So in addition, the healthcare worker has to record that visit in the patient's file.
So this is recorded on the file. What about video recording?
Now this video recording and the images, the recording of the video consult is recorded, encrypted, meaning it's made in a way that no one can access, and then it is stored. And this is this follows the industry standards, the HIPAA, the POPI, and the Kenyan standards.
All right. Yeah. Okay, so now as we wind up, what would you tell the audience? Because there are people who are not really open to new technologies, and there are also people who are really skeptical about embracing new things. What would you tell them about, in as far as telemedicine and telehealth is concerned?
All right, thank you. I would say technology is here with us. A few years ago, having a mobile phone was like a dream, but now having a mobile phone is like a necessity. And so it is the same with telemedicine. We have been doing telemedicine to some extent. When you call your doctor, your nurse, when you send a picture, when a prescription is sent to you via your mobile application, when the Ministry of Health sends you a message to tell you, remember to wash your hands, take these steps to protect against COVID, all that is under telemedicine. So really you have been engaged in some form of telemedicine or other. Most of us have.
Definitely.
Yes. So this is just a progress, another step forward. Don't be afraid. It is not difficult. It is very easy to use. It is very safe, and it is convenient. It saves your time.
And there are telemedicine experts who are going to guide you on the best way to go through this. So you won't be alone. You have a whole team of experts who have experienced this before. So they are going to help you really to cope and get to understand more the best way to do it. Our time is almost up. Your last words, kindly.
All right, so at the Mater Misericordia Hospital, we are committed to giving you the best healthcare because we care more. We have started the telemedicine pilot in order to serve you better. It's going to be big. It's going to be very useful to you. Kindly come to one of our branches, visit our branches, and inquire more about telemedicine. In addition, our current branch at the Well and our Westlands branch at Kenrail Towers are now open on Sundays. So feel free to walk in, call us, and inquire more about the services we have. Can I give out our number?
Yes, you can.
Yes, so you can call 0732 16 3000 or 0719 3000 and inquire about our services.
Thank you so much, Dr. Thuo, for that informative session. We really appreciate your time. Thank you for passing by. All right, thank you, dear viewer, for being with us. I believe you've learned more on telemedicine. For those who have sent feedback and interacted with us, thank you so much. For those who will view this or watch this later, do not hesitate to send your questions and feedback. We'll make sure that you get the response as soon as possible. Now, remember, as I said when we started this health discourse, health is the most valuable asset that you'll ever invest in, because it is the best wealth more than anything else. So that's why we bring you this kind of informative sessions, and we believe that in the end you're going to make informed decisions in as far as your health and the health of your loved ones is concerned. Now, I have been with a very formidable team as usual behind scenes, and these are our camera operator Christopher Diambo. We have who is also been helping with visual mixing. Alongside Clinton China, we also have our sound engineer has been Eric Otieno, and as usual in the transmission section we have Peter Mwangi. Thank you also the entire team of Capuchin TV and Mater Hospital, including Sister Bernadette Mweni, who is the organizer from the other side of Mater Hospital, and Father Vincent Shumila, who organizes from this end of Capuchin TV, our administrator, Sister Karanja Teresa. Thank you so much. I hope you're going to learn more from this. Now, from here, there is a team that is already set at St. Austin Songari for the Requiem Mass of Father Anthony Karanja Wamukami and burial thereafter. All this will be live from St. Austin in Msongari. May his soul rest in peace. My name is Sasha Elizabeth. See you next time. Take care and be safe. Have a great weekend. Goodbye.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients